Welcome to the DoubleACS Daily News. Along with the rest of the state, Sturdy Memorial Hospital has seen an increase in cases of COVID-19. Dr. Brian Patel says that while they are seeing more cases, they are also seeing less severe illness. We spoke with him to learn more.
My name is Brian Patel, and I am the Chief Medical Officer here at Sturdy Memorial Hospital. As everyone I'm sure is aware, COVID-19 continues to be very prevalent in our everyday lives. Currently, we're going through yet another surge of COVID-19 with the Omicron variant. And unfortunately, the numbers continue to rise in this area and within the state. This is a variant that is very, very infectious and spreads very easily. And so we're seeing numbers that in some cases are exceeding the positivity rates that we were seeing back in the beginning of the pandemic. Locally here at Sturdy, of all the tests that we're doing through our drive-through areas and through the hospital, we're seeing a test positivity rate upwards of 35 to 38% on a weekly basis, which is not too far off of what the state is seeing. They're seeing test positivity rates around 23%, and that number is pretty comparable to what it was back in the beginning of March when the pandemic first started. Thankfully, the one difference is that this variant tends to cause less severe illness. So while we're seeing a lot of people with disease, we're seeing a fair number of people with mild disease, which is good. However, there's still a lot of people getting hospitalized because of COVID-19 with this variant, and we're seeing hospitalization rates that are the same, if not a little higher, as compared to what they were back in the beginning of the pandemic. And so there's still a very good risk of getting severe COVID-19. And of those people that are getting severe COVID-19, the vast majority of them are unvaccinated. And so vaccination still remains a very, very important step to reducing the severity of the illness. Nothing's 100%, and so no one's saying the vaccine will prevent you from getting COVID-19, but it is very important to understand that it will significantly help reduce your chances of getting severe COVID-19 so you don't end up in the hospital and you don't end up dying from COVID-19. This variant also is causing much less deaths as compared to prior surges, which is really good, but I also think that vaccination is playing a key role in that as well, and so it's helping reduce the severity of disease for people that are vaccinated. I liken it to the flu, right? We get a flu vaccine shot every year. We know that shot's not 100%, and we know that there's still risk of spreading flu even if you've been vaccinated, and the same is true with COVID-19. And with this variant being so much more infectious and much more easily transmissible, it is very important still to wear masks when you are indoors, in public settings, in crowded settings, to try to prevent the spread of the disease. In terms of treatment for COVID-19, if you do get COVID-19 and you're a relatively healthy person and you have mild disease, the treatment is supportive therapy. And so you should stay home, isolate per CDC guidelines for a minimum of 5 days, use over-the-counter medications to help treat your symptoms, lots of fluids, and rest. If you have disease processes that may put you at higher risk for getting severe COVID-19, things like diabetes, heart disease, lung disease, then you should talk to your doctor about potential options for other treatments that you can get as an outpatient. There are medications that we can provide. Unfortunately, right now, because of the supply chain, they are in very, very limited supply. And so the opportunities to get the medications are limited, but it is still worth talking to your healthcare provider about the potential opportunities to get referrals for those medication treatments. Obviously, if you develop severe shortness of breath, chest pain, dizziness, you feel like your symptoms are significantly worsening, you should at least talk to your doctor about your symptoms, and you may get referred to the emergency department for further evaluation. Right now, children ages 5 and above can get vaccinated for COVID-19 with the Pfizer vaccine, and they can get the 2-shot series for COVID-19. If you are 12 years and older, you are now eligible to get a booster, and you can get that booster 5 months after you finished your Pfizer vaccination series or your Moderna vaccination series. For people 18 and older, if you're 2 months after your Johnson & Johnson series, then you can get a booster as well. There's a lot of opportunity now for children to get vaccinated, and I do, again, encourage that for children that are eligible for boosters, they should also start getting their boosters as well. Most of the hospitals, if not all of the hospitals in Massachusetts, are at or over capacity, and it is very challenging right now to get beds in the hospital and to get patients admitted into the hospital timely. So we want you to come to the hospital and to the emergency department if you have an emergent reason that you need to come. What we are asking is that if you have mild symptoms of COVID-19 or you are just looking for a COVID-19 test, that you do not use the emergency department to do that, because it then prevents us from being able to provide care for the people with emergent needs that truly need to be seen in the emergency department.